Choosing the right health insurance plan is vital, but it's only half the battle. What happens when you actually need medical care? And you have plenty of questions to go along with it. I would like to welcome Dr. Annette Takouras from Guided Patient Services, a group that focuses on the patient. So it sounds good. It's nice to meet you, Dr. Takouras.
It's great to be here.
Okay, Guided Patient Services. First of all, what are you all about?
I myself am a private patient advocate. My training is as an internal medicine physician. I saw a need in the community when I was in the hospitals for some more advocacy, people coming along beside you, helping you navigate healthcare. So I started my own company to do just that.
And why is that such an important step, to have an advocate for the patient?
Well, I think we all know that as time has gone on, the healthcare field has become a bit of a maze. It's very confusing, it's very complex. It's almost like a foreign language. So people are looking for someone to help them take away some of that stress, that misunderstanding, the feelings of being overwhelmed, and that's what we're able to do as a patient advocate, is come alongside and bring some understanding to that.
And this time of year, I should say, is a great time to kind of have these discussions. You're mentioning, we get together with our family, right? We have important decisions because it's a time we're all together. So what kind of advice do you have for folks as they get together for Thanksgiving, for Christmas coming up?
Well, I try and encourage them to have those conversations that maybe they've been trying to avoid. It is the holiday, they're happy to be together, but this is also a time where siblings are gathered and you're with your aging parent. I think this is a great time to think about where are we now, what resources do we have in place, what resources might we need to put in place should their health or the situation change.
Why is it so beneficial to have somebody like yourself working through a crisis, maybe even meeting you before that happens and kind of having you by their side throughout?
Again, it comes back to just the complexity. People are overwhelmed and they're being asked to make some fairly life-changing decisions regarding perhaps a new diagnosis or a complicated diagnosis, and they don't have the information that they need. And if you have an advocate there, at the very least, they can bring you up to speed and give you a deeper level of understanding so that you can make those choices.
Recently, the term elder orphan has kind of gained some traction. First, explain to us what that is and how you can help with it.
An elder orphan, I think we think of just someone who is alone, and that is it. It may be for numerous, various reasons. It may be someone who no longer has a spouse, they've been widowed, divorced, maybe they never married, they may have not chosen to have children, or they've outlived their children. They may have siblings that they're counting on to be there for them in their older years, but they maybe have ailing health. So it's really anyone who might find themselves in a health crisis without the support they were hoping to have.
So when should someone reach out to you? What is that kind of magic date?
Ideally before you need one. So I've done my best out in the community to try and encourage those people who find themselves at risk. And amazingly so, the statistics show that those from 45 to 63, about a third of those are at risk for being an elder orphan. They just haven't come to terms with that yet. So I would encourage them to think about finding someone, whether it be family, friend, or an advocate that they could get in place ahead of time so that if that day comes where they're in the hospital or there's a crisis, they've got someone there by their side.
And let's get a little more specific about how you can help folks. So say they get a diagnosis, they're in the hospital, they call you. What can you help them with?
Really, I can, from the moment that we're able to meet, I can kind of get busy. In most cases, we find that communication is the biggest tool that I'm able to bring. As an internist, that was what I was doing in my years of practice. So I'm able to get all the different parts talking to each other, and then most importantly, I'm able to relay that information and share that information back with family in a way that they can understand it, maybe in multiple occasions, and just getting up to speed and unpacking what has happened thus far. We usually can make great strides pretty quickly.
And I kind of likened you to almost a walking medical chart for some folks because you can follow them to different hospitals, different providers, different doctors, and that can be overwhelming if you are supposed to, be the one kind of waiting for the care and also knowing what to tell doctors and hospitals.
Yes, I've had multiple situations where that has been just the case. In fact, I'm carrying with me today, files that do belong to people. I am HIPAA compliant, so I want to make that clear that I'm very careful with people's records, but numerous times, for whatever reason, emergently or by choice, they end up in another healthcare system. And although we have electronic medical records, they aren't always compatible, and that information isn't always conveyed. So I can quickly bring a new set of medical team members up to speed and make certain that things aren't being duplicated. There have been multiple times they've wanted to conduct the same testing or procedures that have already been done, and because I've got them handy or I'm able to bring them we're able to avoid some of those extra.
Okay, so Dr. Annette Tekoris with Guided Patient Services, really just an advocate for the patient. That is what you want to get out there. There is a fee typically associated with her services, but give her a call today. Sit down, have a meeting, and get things started. I want to thank you for being here.
Thank you very much.